My name's Dr. Liz Walker. I'm an anaesthetic consultant here at Solihull Hospital. The purpose of this video is just to give you a brief oversight of the different types of anaesthetic you could experience when you have surgery. When you have an anaesthetic, there are three possible types of anaesthesia. The first is general anaesthesia, the second is regional anaesthesia, and the third is local anaesthesia. General anaesthesia, I think, is what people are most aware of, and it's when you're in a deep sleep-induced state. Regional anaesthesia is when we numb a large part of the body and you have the option of either being awake or sedated for the procedure. And local anaesthesia, which is generally performed by the surgeon rather than the anaesthetist, is when we would numb a very small part of the body, such as when you're removing a skin lesion. And again, for that, you can expect to be awake. So deciding on the type of anaesthetic is largely determined by the particular procedure that you're having done. It's a joint decision-making process. So whilst the anaesthetist will make a recommendation to you, it's very important that we listen to the patient as well. So if you have a preference or if you have a particular concern, then it's worth explaining that to the anaesthetist. We also take into account not only the type of procedure, but any specific background medical history, and sometimes the type of medication that you're taking may also influence the anaesthetic choice. So when you have a general anaesthetic, as previously mentioned, you're in a deep sleep-induced state. You're completely unaware of what is happening around you. You'll have no memories of events and you'll be completely pain-free. When you have a general anaesthetic, we'll bring you into the anaesthetic room, and that's where you'll meet the anaesthetist and the operating department practitioner who assists the anaesthetist, and you'll meet the surgeon. We'll perform our safety checks and then we'll attach the standard monitoring. And for most patients and for the majority of procedures, that will be 3 dots on the chest to see what the heart is doing, a blood pressure cuff, and a peg on your finger to look at your oxygen levels. There are 2 different ways we can induce anaesthesia. One is to give you medicine through the cannula on the back of your hand, and that is what we would do for the majority of patients. But for some patients, it might be due to patient preference, or it might be because it's difficult to get intravenous access. It may be that we'll give you some anaesthetic gases to breathe in, and again, that will just gently drift you off to sleep. When you have a spinal anaesthetic, we can either do it as a sole technique or combined with a general anaesthetic. If you're having a hip or a knee replacement, then it would be common after you've had the spinal anaesthetic to have a choice of whether you would like to be awake during the procedure, or more commonly, whether you want to be sedated during the procedure. If you're awake, you have the option of bringing in headphones, listening to music, listening to an audio book. But if you're sedated, then we'll give you medicine through the cannula on the back of your hand to keep you in a very relaxed, sleepy state all the way through surgery. By that means you'll have very little memory of the procedure. If we use a spinal anaesthetic as part of a combined technique, this would be much more common in bigger procedures such as an abdominal operation. And in this situation, we're using the spinal anaesthetic primarily for post-operative pain relief. So after you've had your spinal anaesthetic put in, we would then induce general anaesthesia so that you're asleep for the duration of the operation. The advantage of having the spinal for post-operative pain relief in this context is that it gives you very good quality pain relief for after the operation, and it reduces the chance of any nausea and vomiting after the procedure, and it also gives, in most patients, will give them a better quality recovery after the procedure. I'd also like to signpost the Royal College of Anaesthesia website, which has a patient information leaflet section and useful videos, which will provide a whole host of information which you may find useful to read before your surgery.